is attending on her behalf. Dr. Shilpa Shapapashad, Paul Higgins and Amanda Wilson.
Do we have any declarations of interest or transparency statements? That takes us on to the minutes of the previous week. So it's pages 5 to 10. I don't think we through them, but if there's any questions or comments. Yes, I take that as a good reflection of the last meeting. Please. Which takes us on to the appointment of Interim Chair. So that's just for noting. You're welcome, Pam. Congratulate you for your position. And just for that to find council. All agree that. And we move on to the membership update. Mark.
Thank you. Obviously, anyone attending the meetings have the opportunity to see the paper, so I don't want to spend time going through it. But there is an update to the paper. Paragraph 1.3 discusses Paul Higgins being replaced by Leslie Mish as a non-voting member for the IGB. Paul was also a member of the Audit Risk and Scrutiny Committee, and he will be replaced on that by Fiona Dove.
That's it. So that's all, please. This is on to item 4, which is Chief Officer's report. So Angela.
Morning, everyone. I'm really just going to pick out a few key highlights from the report because I appreciate people have had the opportunity to read through it. So if I start off with the performance update around delayed discharge, as members will be aware, a key priority for the Scottish Government is reducing the number of delayed discharges across Scotland. And in order to address some of the challenges, a weekly meeting has been established, and that's called the CRI, and that's chaired by the Cabinet Secretary. All chief officers across Scotland are expected to attend, and that's alongside Scottish Government colleagues, the Care Inspectorate and COSLA. The Scottish Government have set a maximum target of 34.6 delays per 100,000 adult population. And all HSCPs have been placed as a result of that target in 3 categories: low, moderate and major. And that's based on the level of performance improvement that's required. In Renfrewshire, we continue to perform exceptionally well and have sustained this performance for a number of years. As at the 10th of February, we had 11.2 patients per 100,000 of adult population who were delayed for their discharge, and that's compared with a Scottish average of 43.9. At the time of preparing the report, Renfrewshire had the second lowest level of delays across Scotland and continues to be in the low category with no performance targets required. If I move on to CAMS, our waiting time performance as at the 17th of February remains excellent. We have 100% performance against a national target of 90% of children starting treatment within 18 weeks of referral. As noted in my update, there are implications arising for CAMS in terms of funding, and that was outlined in the Scottish Government's funding letter that we received in September 24. Further details on the impact of this for CAMS is contained within the Enhanced Mental Health Outcome Framework report, and that will be presented by Pauline Robbie a bit later on in the meeting. If I move on to our staff awards, each year the Health and Social Care Partnership holds staff awards to recognise the exceptional contribution of our staff make to providing high quality of services and supporting the most vulnerable people across Renfrewshire. This year's staff awards were held on the 26th of February, with the ceremony providing an opportunity to celebrate a number of examples of excellent practice across the partnership. A highest ever number of nominations were received with 67, and across that there were 6 awards, 6 categories of awards. Although it was a really difficult task to choose the winners due to the exceptional high calibre of nominations, we awarded 6 winners, 6 highly commended and 2 Chief Officer awards. And myself and the management team would like to formally thank all of our staff for their commitment and their contribution to supporting the most vulnerable residents within Renfrewshire, and a huge congratulations to all the nominees and winners. If I just move on then to the key national updates, members will be aware on the 23rd of January, the Minister for Social Care provided the Scottish Parliament with an update in terms of the position on the National Care Service. The update reiterated the Scottish Government's continued commitment to creating a National Care Service, however, outlined a number of proposed revisions to the bill. A key aspect of the bill that will remain is breaks for unpaid carers, and in the draft budget statement for 25-26 from the Scottish Government included an additional £5 million of funding for voluntary sector short breaks, bringing the total fund to £13 million. In Renfrewshire, supporting carers to get a break remains a priority. In 24-25, 70% of our Carers Act funding was allocated to providing carers breaks. Alongside this, we also commissioned Renfrewshire Carer Centre to provide a range of opportunities for carers to access a break for their caring role. If I move on to something that's been quite widely reported in the media, the Scottish Government's NHS renewal plan. On the 29th of January, the First Minister for Scotland launched Scotland's NHS renewal framework, which aims to safeguard the NHS and achieve the full potential of innovation. 3 priority areas were identified based on clear understanding of where we are and what changes are needed. The first priority was to reduce the immediate pressures across the NHS. The second is to shift the balance of care from acute to the community. And the third is to use digital and technological innovation to improve access to care. There will be specific focus on delayed discharge, as we've mentioned earlier, being that's one of the key priorities. Additionally, the First Minister included some information on around 2,000 virtual beds across Scotland being in place by 2026. Work is already underway across NHS GGC and 6 health and social care partnerships within NHS GGC, Renfrewshire included in that, to start the initial planning to help to support the delivery of these priorities in a whole systems way. In terms of further updates, the Integrated Joint Board Financial Bulletin was released on the 6th of March 2025. Audit Scotland published a very sobering Integration Joint Board update. The bulletin provides an analysis of the ongoing financial challenges faced by all IGBs across Scotland and reiterated the need for longer-term transformational change to support sustainability. Some of the key points in the bulletin included a concerning picture of continued depletion of IGB reserves, a worsening financial position across all IGBs with a projected funding gap of 457 million for 24-25, and the need for IGBs to work collaboratively with their NHS partners and council partners to find transformational ways to sustain IGBs for the longer term. And finally, we received a letter from the Chief Medical Officer. It's not included in the report, but I thought it's important to raise. We received a letter from the Chief Medical Officer on Wednesday, provided us with information on the 2025 Spring COVID vaccination programme, and that will run from the 31st of March to the 30th of June. The Joint Committee on Vaccination and Immunisation advised that the cohort that will be included in the vaccination programme will remain identical to those that were vaccinated in 2024. So there's really been no change to the eligibility. That's me in terms of the update. I'm happy to take any questions or comments from anyone.
Thanks for that, Karen. Do you have any questions? Again, that's.
Thank you, Karen. Just to pick up on the delayed discharge performance piece, I think what you described there does set out the metrics and the challenges, but I wonder the way we describe it, like 11.2 people out of 100,000, feels quite distant, but actually what that measure means is that the reason we focus on delayed discharges is actually to have discharges without delay, so that the most vulnerable people are not in the wrong setting. And I just wonder when we describe it like that and so much focus that it loses a little bit of emphasis around what we're actually trying to achieve, which is we know, and all clinical studies show, that if a person should not be in an acute setting, then their health and general well-being tends to deteriorate. So what we've said there is accurate, but actually loses a lot of the flavour of what we're trying to actually achieve in the partnership. And I wonder if there's something that we can do to make that a little bit clearer, because what we're trying to do is make sure that people in Renfrewshire are in the best place for them, freeing up acute healthcare setting for people who might need emergency care and flow. So I just wonder if there's just something in the language there that we need to do more of and communicate why this is an adult. Because when we get into 11.2 out of 100,000, it probably doesn't mean that much to those that are not filled into all of these matrix.
I suppose in terms of Renfrewshire, we focus on every individual rather than the numbers. So we know the point, the backstory to that individual, but we're also absolutely focused, as you rightly described, Mike, not on those patients who need to get out of hospital, but that admission prevention and keeping people at home. So there's a number of things we are doing around the unscheduled care agenda that supports that number of people into hospital. So we're targeting it there. We've also got our home first response service at the hospital door, who, for patients who can get turned around really quickly within that 72-hour period, they bring those people back home into the community and have a team ready to support those people. So for us, a lot of the success is that admission avoidance in the first place, that early discharge from hospital, which is why we've seen, I suppose, that sustained numbers in terms of our delayed discharge. But for us, every single person delayed in a discharge is discussed almost twice daily. So we know the family story, we know the individual story, and we do everything we can to make sure that that person is back home and that we're supporting those challenges that we're facing in the acute system.
Mark.
Thank you for the report, full of useful information. I'm pleased to see the rights to breaks for carers being mentioned, along with the Scottish Government's 5 million for short breaks. These are very important for carers. I see 70% of the Carers Act money went to funding rates, and the other 30% most of it again went on funding rates, which is very welcome. At 11.6, you mentioned about the carers planning group. The last 2 meetings have been cancelled. That's something we need to get back up and running ASAP, because that's quite an important link. I see 13.3, the land bill has been delayed. At the same time, we're planning cutting autism connections. I'm very concerned that it's going to be a section of our society which is going to fall through the gaps if we're not careful. My question really is when will we know how the Carers Act money for 25-26 is going to be spent? Thank you.
I can come in. The Carers Act money will be in exactly the same way that's been allocated in previous years. We have a contract with the Carers Centre, so that will continue, and the respite will continue. But it might be important to note that actually we are significantly overspent on respite. It's about 600,000. So not just the carers money goes into that, but other base budget going in there as well.
Thank you for that. And we'll turn on mic to Councillor Sunday.
Thanks, convener. So I suppose firstly what I would say is I agree with what Mag said around delayed discharges. I think the paper's really good and it fleshes out the numbers that we should be aiming to meet and those sorts of things, but I do think that narrative around why we're doing it is really important. I think as IGB members we have it in our heads why we're doing it, but when we're talking to the public and looking at decisions we make, it's probably important that they see why we're making the decisions and why there are focuses on those things. It's great work that's being done, and I think the human impact of that is really important. So maybe if we have a wee bit more detail around that. And then I wanted to refer also to the kind of renewed decisions around the National Care Service, which I think are sensible, and particularly the rights for carers to have breaks. And you've set out a few things in the paper that we can do now. I think that's really important in terms of getting in front of it, so that when they're saying you need to do X, Y, and Z, we can say, well, we need this amount of money and this amount of resource to do that. I think that's really important. And I wondered how much of it is doable just now in terms of the timeline of if we're looking at maybe next term in Parliament, that's only a year from now that it starts. So how much is doable just now and how much is kind of a watching brief, because we'll need more detail. That's maybe a bit of an open question, Karen, so I'm willing to take whatever information you have just now.
I think in terms of the revisions to the National Care Service, I think the thing that we can continue to do, as we've described, is that the kind of carers break and how we take that forward. I think for a number of the other things, it might be a kind of watching brief, wait till we get a wee bit more detail around it. Now, I know the first meeting is in March, so there may be something comes out from that committee that's been set up to review it. I don't know the date in March, but I hope that there will be some information will come out after that.
Thanks, Karen, that's appreciated.
Yes, sir.
Thanks very much. Just a couple of comments and then a question at the end, if you don't mind. Delighted to see the carers right to break getting mentioned here. I think the politicians that are in the room today, we all have our doubts about the National Care Bill. But this is certainly one thing we're happy that it's still continuing. I must admit, I'm a bit sceptical about this NHS renewal plan. I've been hearing renewal plans for donkeys, and nothing seems to improve. That's not to say I'm not going to get behind it and support it. I just going to wait and see if there is any improvement. And of course, a lot of the NHS renewal plan is all about hospitals and stuff like that. But right beside that, and that's why we're here today, the IJB, the services that IJB provides, a deficit of £427 million this year. Truly staggering amount of money, and is extremely concerning. Try to be a wee bit more positive, and would like to thank the staff for their work during the storm. Well, we were all kind of huddled in the house, looking out the window, all the trees going about. These people were out and about doing their job, so I think they've done tremendous. And I'm sure there will be lessons learned, and I'm sure there was mistakes were made. But just I would like to express my own personal thanks to the staff who battled through those storms. I particularly like the very last paragraph in this report, when it's talking about prevention and early intervention. I think that's the key. But finally, my question is again about delayed discharges. Again, we seem to be doing really well, and we've been saying that for a number of years at this particular forum. But obviously, it's very staff intensive, takes up a lot of time and a lot of resources. Can I ask Karen or anybody else what impact, if any, that has on other services? So much time has been spent on this, and I understand why it's happening, and I support it. But is there a negative side to that in terms of impacting other services? Thank you.
I suppose in terms of those patients, as we say, our numbers are pretty low. So although we meet twice a day to discuss those figures, the staff time would be dealing with those patients anyway. All of them who require that support plan would be getting that, would be getting a social work assessment, would be getting that level of intervention. So there may not be, in terms of staff time, more time spent on those patients or delivering that care to those patients. What we do in Renfrewshire is we get in there really quickly. We do lots of downstream work. So the minute a person comes into hospital, we start that planning with that family, with the staff, so that patients then don't come on to hit that delayed discharge. So that's where we've got quite proactive approaches to our delayed discharge. But in terms of being able to identify, is that more staff intensive than normally would be? I think for those areas who have got much higher delayed discharge than us, I think they spend a lot of time focusing at that end. when the patient is delayed, rather than that being proactive and getting patients out. I don't know if that answers
No, that's
your
right.
question.
Thanks, Maggie, that's Karen. And then Councillor Cap.
Thanks, Chair. Yeah, it was 14.6. I was really pleased to see and increased collaboration between Police Scotland and HSCP mental health concerns. I know that's something that we're quite good at already in Renfrewshire, so to see that improved is really positive because, Police Scotland are under pressure of their frontline services, so it's good to see them freed up, and that way they can spend hours and hours if someone's in mental health crisis, and anything that we can get them is really positive. So I was pleased to see that. And less positively, I shared Mark's frustrations about the land bill. I'm going to copy your acronym because it's quite a acronym, because it's quite a mouthful. But I mean, I was chair in 2017, and I'm sure we've been having these conversations for seven years or more. And I think for that client group, I think they just see it as a lack of perspective, I would say, because it's been delayed. And I know that's not our responsibility as an HSCP, but I just wanted to highlight that. And any conversations that we can have in the forums that we're in, I think we should be pressing that point, because I can't believe that we're here in 2025 and we're delayed again. Thanks.
Appreciate that, Councillor Carroll. Thank you very much for your contributions. Okay, there's no other questions or comments. Can I please know the Chief Officer's report? Yes, please. And that takes us on to item 5, the financial report from the first of April to the 30th of January.
Okay, as usual, I won't go through it in too much detail because everybody will be familiar with the information within it. Yet again, it's positive news in that we have moved, the reduction in the overspend has moved yet again this period, and that reflects a huge amount of work being done by various teams throughout the partnership to try and reduce spend wherever we can. So the current overspend projected for the year end is 3.9 million, and that's a reduction from the original 10.7 that we started out with in April last year. And I think what I would reflect in here, and it does say in this, it relates to Mark's question about what we spend on respite. We do have an overspend of 600,000, and that's detailed in section 3 under the third party payments. So that contributes to part of the overspend, and that does purely relate to carers respite. So what I would like to draw your attention to is section 6.2, and show the positive movement in prescribing. And since October last year, the decision has moved positively by 1.2 million. And then that reflects a number of areas that are detailed in the table in 6.2. So that's a really positive movement for us this year. As you all know, the volatility in prescribing continues, and there is only so much control that we have over it. But that is a positive movement in year for prescribing. I think the only other thing that I would draw your attention to in the report is in 8.7, the fact that we will need to draw down about 3.8 million to deliver break even, which is part of what the IGB agreed last year when setting the budget. So happy to answer any questions, but I think the detail as you tell.
Any questions or comments?
Thank you. I picked up on your point 8.4, the general reserves. Talked about how the target is 2% in your general reserves, and at the end of March we're down to 3.7 million. As an economic account, can you possibly explain the significance of that? I'm sure it's not later in discussion, but you're below the recommended level. What significance that has to the working of the IGB?
So what that does mean, it reduces our financial resilience going forward and our flexibility to help fund things that come out of the blue. For example, this year we've had to fund the backdated pay claims with the upgrade for care at home. So usually section board of 6 bodies like ourselves prefer to have a resilience budget of about 2%. That's the kind of norm. So we will perform significantly below that at the end of this financial year, which will be a point that will be raised by the auditors when they do the accounts. But our ability to increase those reserves is now limited going forward, but basically affects our financial resilience.
Any other questions or comments? Councillor Carroll.
Next year. Yeah, just to say, Sarah, I thought that was great news about prescribing. And thanks for all the extra information you've given us and describing. As everyone knows, with the development session recently, and the presentation we got on efforts to reduce prescribing and costs was great, and it just made it really included us. There's a lot of good work going on out there, not just in HACP, but in primary care and NHS. So that was really interesting. And I think the public probably don't see that work happening, but I know that part of the progress that they want to make is to like know what's happening out there. So thanks for that.
Thank you. If for questions or comments, we can read and look at conclusions of page 27. Move on to item 6, which is then the enhanced mental health outcome framework. Now, I have to say, this is probably one of the most grimmest reports I've ever read since being an elected member. And unfortunately, they're not here to be able to amend any of the decisions that you see have been made. It's been made in by Glasgow IGB, most services ever have, and really, you know, all the details of your outcome, the impact it's going to have on people, and it's just sort of pretty heartbreaking to read. I feel as if we made such great strides over recent years, you know, when it comes to filling positions. Unfortunately, I feel this is state. But I'll open up to questions and comments. Page 14 to 60, enhanced mental health outcome framework. Yes.
Thank you for the report, and all staff put it together. I'm concerned to see there's some discrepancies in canons. In 5.3, the report states there's an excessive backlog, which the carers agreed to. Yet in the Chief Officer's report, in item 4, today's agenda, in 6.1, it says the carers waiting time is 100% as of February this year. There seems to be a big discrepancy there. Is there a waiting time for carers or is there not? You know. Also in 7.3, there's a shortage of one school nurse. I think our partners need to look at that, because if we can catch children younger, then they won't have the problems going forward. And my final point is in 9.4, the third bullet point, it showed 2.4 years waiting time for adults ADHD assessments. And it also talks about other areas doing away with the assessments. And it says Renfrewshire is going to contribute towards it. Does this mean that Renfrewshire is going to be doing away with adult ADHD assessments?
Okay,
thanks. 5.3 refers to the neurodevelopment pathway, which you're absolutely correct. Some children who are also waiting treatment for CAMS are also waiting treatment for neurodiversity, others aren't. And there's been a significant influx. In fact, an enormous influx in requests for assessments, as I'm sure everybody is very aware. So that waiting list is not necessarily the CAMS waiting list. What Karen addressed in our Chief Officer's report was the CAMS waiting list meeting 18-week target at 90%, and yes, every partnership is meeting that. But the challenge of the reduction in funding and loss of the staff that's detailed in the report means that the ability to further work through the waiting list for neurodiversity will be impacted. Now, specialist children's services are working on different ways to approach that, and realising that's a significant burden right from 0 to 5 age and getting into school and all our young people as well. So they are working in ways to mitigate that. I'm just not clear in what they are operationally at the moment. The next part, I think you asked about school nursing. I think that's the next point. So yes, there's a reduction, and we are not at a full model, which I think we got from the report, that we're still training our staff, given that school nurses are on post across Scotland. It's very difficult to fulfil, so they're required to be supported through an educational component to have the appropriate certificate. So we're currently, as it says in the report, 6 full-time equivalents. We were expecting to have a funding established at 7.6, but for reassurance, we're actually out for advert for a further 2, which would bring our establishment to 8. And I absolutely take your point in relation to that early tier 2 intervention to prevent going on to CAMS. And we're working across the board to look at pathways for school nurses and how they can achieve that with the reduced funding and how that's possible. We're not at model yet, so there's still a bit of time to go to get to that.
The last point that you made was the adult, the adult assessment. I wonder, given the breadth of this paper, and there's other offices, it's probably better to answer that, particularly given that mental health. So Caroline Patterson's online. I wonder if I could pass that over to her to give a bit of information around adult neurodiversity assessments.
Hi, thank you, Pauline. Yeah, so just from a Renfrewshire perspective, ADHD assessments do continue, and it continues within our core funding of the community mental health teams. Where we are, we've had a significant increase in referrals that come into the community mental health teams, but we only have a very small resource who are skilled and trained and able to deliver the assessment, and then obviously the follow-up of the treatment, because that sits with us in secondary care. However, there has been work across GGC collaboratively looking at a more streamlined approach to dealing with ADHD in particular, and currently just now there is a paper going to the board to look at a collective way forward with all the 6 HCPs, and I think it's going to the CMT, the senior management, for consultation first, and then it will be brought back with decisions. But the paper, I've not actually seen it myself, but it will be looking at, as I say, a collective way to how we can then reduce the waiting times. That there has been initiatives looked at, looking to get those waiting longer, and we're currently doing that as well within Renfrewshire. Anybody who is on the waiting list who does have a mental health need, they are prioritised through mental health services, through assessment, as what we would expect for care and treatment to deliver that way. So as I say, probably just for reassurance, we are delivering ADHD. What we can't do is just keep up with the amount of referrals that are actually coming into us, but we are looking at it very closely to see how we can get more staff trained also, because training, they have to be expertly trained in order to do those assessments. But happy to take any questions further on that.
Thanks, Mike. Can I just ask for a bit of reassurance? I know we spoke about it at the pre-agenda with regards to the MD health checks. So is that yourself, Pauline, would be able to give some?
I'm going to pass over to Stephanie if that's okay for to answer that particularly.
Okay, what were the LD health checks?
Yeah, so you can bit of information about that.
Yeah, no problem.
Okay, so you'll probably be aware that NHS health boards were given £2 million by Scottish Government to look at annual health checks for people with learning disabilities. In this programme is managed by East Renfrewshire. In Renfrewshire at the moment, the most recent figures I have is that 70 health checks were offered and 39 people attended. So that programme is ongoing at the moment.
Well, that was it, Stephanie. I heard that there was a staff dedicated to doing that in Renfrewshire, so it wouldn't be impacted this year that we would all be able to have the checks.
What I would say is that there has been recent research out of Glasgow University in relation to people with learning disabilities. It was in the media, and actually I was at a Social Work Scotland meeting yesterday, or on Wednesday this week, and there is research into the fact that people with learning disabilities are 9 times more likely to pass away out of preventable illnesses. So there's research that's ongoing and research around that as well.
Thank you for that. Yeah, see your hands on.
Certainly, summary report, as you said, Chair. There's a few things I could comment, but I'll restrict it to the CAM service. It's just a pity the reduction in the staffing, given the amount of work that's been done in recent times to try and turn this whole service around, and then what I could make out of the head 6 series. So it's a real risk of going back the way. Now, I'm just going to ask, I know we tend to have a mention of CAMs probably every single meeting, and I don't know if that's through accident or design, but can we ensure that we keep an eye on this and it's reported, it's agreed that it's reported every month so we can keep our eye on this, because this is obviously a very important issue, and we all know the number of young people who are suffering unfortunately from mental health problems. So I would just like to kind of keep an eye on it. I know professionally you'll do that out with a couple of hours, we meet every couple of months in IJB, but I think it's important for members to know how that service is coping with these cuts.
It's fine. If you remember when we handed over the hosting arrangements to Western Branch, and that's when we agreed,
Yeah.
we'd make sure it's always on the agenda so we can keep sight of it. So absolutely.
Yeah.
Okay then. Sorry.
Thank you. It's what I really to sum up and it's very interesting. I currently chair Glasgow IGB, which hosts some of these services. But my understanding is that you're only informed of an in-year cut 6 months into the financial year, which led to a particular problem for you, which is very little options here. Am I correct going forward? This will then be the recurrent funding to reach the situation of having to make cuts halfway through the year.
It very much depends on the funding stream. The Scottish Government are working hard to try and baseline as many of these funding streams as possible, which means that they will automatically roll over into the new year. This isn't yet one of them, and there are a few other ones that we're waiting to be baselined as well, because this is a problem for us all. We don't know what our allocation is till mid-year, and when they're being cut, we don't find out till, as we said, 6 months down the line, which makes it really difficult for us to deliver in the year. But they are certainly working with us and the board to try and baseline as many allocations as possible to prevent this going forward. But I share your frustration. It's very difficult to work almost with sometimes when you don't know what your in-year allocation is.
Okay, thank you, Paul. Any other questions or comments? Yes.
Thank you, Chair. Yeah, I just want to say that I understand that nationally, UK-wide and Scotland-wide, the financial outlook is pretty grim. But I think when governments are looking at reduction in funding, they have to think about the consequences. Basically, short-term fix for extra cash, and then look at the outcomes of people with mental health issues. And I think even in terms of, if you're only looking at it in terms of finance, I don't think it squares up either, because for people in a mental health crisis, they cost more. So, reductions like this, they don't work, they just end up costing more to the public purse. And as I've often talked about my advocacy days, mental health services were known as the Cinderella services then. So, we don't want that to worsen or deepen. So I think it's something that should be looked at, and again, we should be pressing the powers that be to have a rethink about this, because it's as I say, short-term fix, and I don't think it's going to be a long-term gain. Councillor McDonald was talking about early intervention and prevention. We'll be talking about that for 20 odd years as well. So that one day somebody's going to have to put their money where their mouth is and implement that. And Public Health Scotland have been talking about it for a long time, and we would urge people to do that. Society's not going to change until we're bold and brave.
Thank you. Thank you, Jack. Yes, Stuart.
Sorry, I just want to make two slightly more positive points, if we can, just within the report. I think it's worth noting that although the funding has been cut nationally, that some of our community wellbeing nurses who are based in GP surgeries were retained through the mental health services, trying to find funding within the core budget to retain those. We didn't retain the numbers we hoped to retain, but we did retain some, and I think that is exactly that point around providing early support and intervention for people who are kind of at an earlier stage of a mental health problem, so they don't then require referral into the mental health team and potentially sit on the waiting list. The other thing around CAMHS I would say is it's worth always highlighting REN 10, which is the tier 2 service, which we've only had, I think, for a couple of years now, John will tell me, which is really important. That is a resource that for many young people is actually what they need, and maybe they don't then need to progress to requiring support from kind of tier 3 psychotherapy or psychiatry. So I think we'd really encourage people to share that website and information. It's got counselling, it's got tech services for support, it's got crisis lines. It's really, really useful, and certainly GPs will be using that, teachers in schools will be using that to support young people with the mental health, and not necessarily requiring long-term CAMHS. So anyone who can use that and prevent that deterioration, obviously that then helps down the line with CAMHS.
Thanks. Thank you, Pastor.
Just to build on some of the comments, yes, extremely disheartening to see what feels like short-sighted cuts, but for me, this really highlights where the NHS reform work that's coming down the track, where there is some additional monies for partners to engage in that, to look at how we might, as what Scotland's saying, and we're looking to shift resources to prevention in that more transformational way. So if not now, when?
Councillor Hughes, that's just on. Sorry about that, listen.
That's all right, Convener, thank you. I'm afraid I'm not going to add anything jolly to this either. Just reflecting on the reduction in terms of perinatal and infant health. I appreciate that the positions that they're looking at taking out there would be ones that would be considered back of house, and we've done a lot of that across the piece in terms of trying to prevent trying to retain as much frontline staff as we can to try and deliver as much service as we can. But I have, across the piece, not just for this service, I have real concerns about the removal of people who are doing things like research. Is so important in terms of prevention, in terms of having the best support for people, in terms of making that we're using the best practices. And I just wanted to highlight the concern there. There is a reflection that it's not as acute an impact on the service, but it is still an impact, and that kind of health improvement work is so important. So I just wanted to reflect that as well. I think these are things that there is a crux where if we remove too much of it, the ability to do any sort of preventative work becomes really difficult. So I just wanted to highlight that. I'm quite concerned by it, although it seems fairly minimal. The piece is not minimal, if you know what I mean. It just I feel quite uncomfortable about it, actually.
No.
Thanks, Chair. It was just, I don't think I'm going to add very much, but I'd be remiss of me not to say that intervention that we all hope for and think is really important can be delivered really well at a kind of local level via lots of community organisations and third sector organisations. And I think Councillor McMillan and others have said, you know, intervention is the best way to stop it being a problem in the future. So I think we really need to commit to that wherever we possibly can. And if there's new resources that may be made available, let's look to co-produced options in local communities that sometimes can be just as affordable and more intervention based. So yes. I note that from that perspective only, but I think it's really important that we commit to that. Thanks.
Thanks for that, Alan. John Shearer.
Chair. Thanks, Chair. I think the issue around CAMS is very complex and it's not a standalone issue. And I think sometimes we put it into a box and we don't consider it in the wider frame of what we're doing. The Children's Services Planning Partnership actually has an overview of services for children in Renfrewshire. And we're currently at the point where we'll be beginning to look back to see what we achieved in the last 12 months and what our focus forward will be. What we have done is we've put in place a number of services at different stages. So the school counselling project is one area of intervention, which should in theory reduce the impact on referrals to CAMS. We need to do a bit of work locally to see whether or not that's having that impact. Second bit is we introduced a school officer, a senior officer who does direct intervention and coaching for schools, and again looking at the appropriateness of referrals to CAMS. And what we should remember about CAMS, it's a high level bar to access that particular service. So our tier 2 that Stuart mentioned, our tier 2 services, we need to make sure that they're being effective. So I think that over the next 3 to 6 months, the Children's Services Planning Partnership will be looking a bit more about our mental health services to see how effective they are, whether we can redirect them. And we will ask some challenging questions back to Eastern Berkshire as the host authority for our CAMS service, to be looking at what is happening to our children who have been referred. But equally, you'll remember over a number of years, we've talked about inappropriate referrals to CAMS. So we need to get that detail back from the host authority. Are there inappropriate referrals from Renfrewshire still going to CAMS? Because each of those inappropriate referrals, whilst the parent or the teacher or the community might feel frustrated, we need to get that to the right place because that creates a backlog in the system. So I suppose what I'm kind of trying to say is that probably by September, we should have a bit more detail about where we're heading in our own local approach to mental health services and support for children and young people. We will, I think, bring something to the Children's Planning Partnership, and then we bring that report to this joint board so that you've got a bit of a perspective locally about how effective we are, where we need change, and what type of support we really need from CAMS from the host authority. Thanks, Chair.
That'd be really helpful, John. Thank you. So if there's no more questions or comments, then we need to note the recommendations in page 14. Moving on to item 7, Sustainable Futures Update Programme. Francis.
Yeah, that's me, Chair. Thank you. So this paper updates on the Sustainable Futures Programme in line with the decisions made by the IJB
in December 24, and then the subsequent paper that we brought in January, which set out the approach to phasing the upcoming activity. So the report details the revised governance arrangements which have been established to ensure the necessary oversight. So that includes a refreshed programme board and the implementation of a design authority. A design authority, it's made up of a group of staff with wider expertise, so people like with a policy background, qualities, HR, and the purpose of this is that they act as a critical friend to review proposed service models, impact assessments before we take these to the programme board. So it's just an added level of scrutiny and assurance. And both these, both the design authority and the programme board have met since the January meeting. In addition to this, significant planning work is underway across a range of areas. The SMT are working with their teams, providers, professional leads, and where appropriate, staff side, trade unions and HR to progress the internal redesign proposals agreed, and also the contract management proposals that the IGB agreed could be implemented through operational governance arrangements, so those are underway. Alongside this, we've been developing proposals and draft integrated impact assessments for the saving ideas that the IGB agreed could be further developed, engaged on, and then brought back again for your consideration in September this year. So this planning work has also looked to define an approach to engagement, which will have two key elements. So the first element of this, which we've mentioned previously, is through focus groups to inform the future model for day services. And this will build on the sort of exploratory engagement that took place before Christmas with focus groups. So we've taken the attendee lists from those previous groups that met last year, and we've added to them for the groups that we're planning in the coming weeks. We note that the focus group model means that we're not able to engage with everyone, but by their nature, because they're quite small, they do enable effective discussion for those to attend and for us to capture views. What we're hoping to do with this is that the attendees, we work with them so that they're able to capture views from the networks and groups that they represent beforehand, and that then they can share the output of that discussion afterwards. And we've been working with Marcus, the carers rep, and the carer centre manager, and on some just initial work around the design of these. The second element of engagement is the sort of public process to gather feedback on the saving ideas, and the saving ideas that the IGB agreed we should develop and bring back in September. And these are the ones that could potentially change how people experience frontline services. So this engagement will be centred around 4 town hall meetings. We're proposing 3 face-to-face and 1 online, but there will also be opportunities throughout the engagement period for people to give feedback out of these sessions, either in written or online feedback. And the proposals, importantly, will be published in advance of the engagement sessions so that people can familiarise themselves with them. So the purpose of the focus the public engagement sessions will be to inform the final integrated impact assessments. So what we want in those sessions is to understand when we, from the proposals that we've set out, what impacts they would have for service users, carers, or other members of the public. And we'll update the impact assessments with that feedback, and that will form part of what we bring to the IGB in September. So I would highlight that finalising the engagement arrangements has taken longer than we originally anticipated for a range of challenges. This work is exceptionally complex, and we are taking it forward alongside trying to maintain well-performing services. It has also been exacerbated by a range of capacity issues. We've had a number of changes, as members will be aware, in our senior management team. We've got additional operational pressure, including things like the planned and unplanned inspections. And we've had reduced capacity across a number of critical areas for a range of reasons, with staff moving on to promoted posts, unplanned absence and things like maternity leave. And I think these very much reflect the risks that are outlined in the report at section 6. So I do recognise that these proposals will have an impact on service users, carers and staff. So since since December meeting, we have been working tirelessly to try and progress the work so that we can ensure that we have meaningful engagement with all the impacted groups. And we have built on the previous feedback that we received before Christmas and the impacts that were highlighted, so that will form part of it, that we're not starting from scratch. And people will be aware our IGB update in January set out this approach, and we have also been updating the care groups and other forums on a regular basis on our plans. Importantly, to highlight the stakeholder communication is planned next week, and it will outline these arrangements for both the focus groups and the public engagement. So this broadly will confirm that the focus groups have now been scheduled for the 1st to 4th of April. So this is the focus groups for day services. The Learning and Disability and Autism invites went out on Tuesday and will issue the other in the coming days. And we've already got staff sessions for the day services that are underway. The public engagement will now take place from early June for 6 weeks, and the town hall meetings will be scheduled later in that month. So we'll ensure, as I've mentioned, that the proposals are published at the start of this engagement so people have time to familiarise themselves with it before the town hall meetings take place. This paper is also asking the IGB to be the approach, a change in approach for 2 proposals compared to what we've previously set out. It's recommending that for these proposals we don't need public engagement, and instead that the senior management team work with staff side, trade unions, HR and professional leads. These relate to the review of care at home services and district nursing, overnight service. This will be an internal service redesign that wants to really change how people experience the service. So we feel that it's more appropriate, like other internal redesign proposals we're taking forward, that it follows the same approach. Also, for the introduction of waiting lists for locality-based respite, this is a business as usual operational matter, and it isn't something that would normally be subject to a public engagement. So it was really just to clarify that compared to how it was set out in previous papers. The final point I would just note is that the Council's Leadership Board recently agreed a new non-residential charging policy from the 1st of April, and there will be shortly issuing charging letters in line with usual practice. So I realise there's quite a number of things in it, so happy for myself and colleagues to answer any additional questions. Thanks.
Okay, let somebody see you the questions.
Thanks, convener. Yeah, a detailed paper and generally okay with the approach. I suppose a plea in terms of the communication. I've been contacted by a couple of constituents who I think probably because what our decision-making cycles usually are, had the impression that we were taking decisions about these services today. That's obviously not the case, and we've kind of stretched out the timeline. So when we're communicating, can we just make it really clear to people that the timeline has changed and indicate to them where things are? I'm sure that's been done, but I think we need to be clear about it just in terms of when people should expect things to happen, because my concern is that we might have people coming to meetings in the next month thinking we've already made decisions, when actually those meetings are really important and we don't want to lose people who would come otherwise. So if we can just be really clear that we're doing that, I'm sure it's been detailed, but I think just a wee highlight of the fact that we're not taking decisions in a March every year and then there are no substantial decisions about those things. The cycle's changed, and I think it's just really important that we reflect that.
Thanks for focusing.
Thanks, Chair. Obviously, there's a lot of work being done there in terms of aligning information to those groups that obviously are crucial in relation to health services, cares, etc. But it's just a more of an offer to Francis and the rest of the team who are working on this in relation to getting information out to that wider stakeholder group through third sector organisations, community organisations, and also being able to sort of aim directly at maybe some areas like the integration network for Indicity, for example. So if there's an opportunity for us to help with that in terms of engaging our membership, just obviously it's an open offer, and be happy to do that. Thanks.
Thanks, Alan. Ian.
Thanks again. It's almost a throwaway line to say that the new charging, the new non-residential charging policy was agreed. Just for members noting that there's quite a disagreement between members of the board that particular day that actually went to a vote. So I'm not saying that the report says it was unanimous. I think it's useful to know that people know that it wasn't a decision that was totally agreed by everybody on that particular board. The public engagement in members be notified of that and be allowed to turn up. I found the last lot very, very interesting and very important when I was kind of making up my mind on the changes. So obviously sometimes they clash with other commitments that we have, and it's not all about the members. And so quite happy for them to go ahead. But if certainly speaking for myself only, if I can get to some of them, whether it's online or it's in person, I'll do my best to get along. The last thing I want to mention is about the key risks. I think these are, quite sobering when you see the risk, particularly at point number 2, that the potential that savings identified are unable to fully bridge the financial step, and that's always it's a worry because we're putting people through an awful lot of pain, an awful lot of worry, and possibly hardship as well. And at the end of it, we might not still be able to balance the books, and that's really the concern. So my question really to Francis is, how much of a risk is that risk? The second bullet point, 6.2. Thank you.
That one, yeah, right. Thanks, Ian. I guess in terms of the risks, a lot of that will sit with the IJB as officers. We are preparing the proposals and the impact assessment, but they will come to the IJB for approval. I guess in terms of risk mitigation, as a senior management team, that's why I've highlighted it in a number of meetings that we continue to look at alternative ways that we can deliver saving proposals and efficiencies, because we can't assume that all proposals will be taken forward. So therefore, in addition to that, we're working as a team to look, and particularly in light of the NHS reform and the council's transformation aspirations too, we're looking at how do we do things differently going forward, rather than we appreciate, sort of taken from all the budgets each year is exceptionally challenging. We're in a place similar to the council and NHS where we realise we need to sort of fundamentally look at the service models that we've got just now and look at alternative ways forward. So that, I suppose, for your assurance, is going to be happening in parallel with the current savings. But there are inherent risks with all of this, given we're trying to keep the lights on with our services, deliver complex savings, and ensure that we keep the stakeholders up to date with that and engage with them, and then in parallel ensure that we're sort of forward thinking and looking at something a bit more transformational and innovative to deliver more effective services going forward. So that is exceptionally challenging, but without risk. But we are mindful of that, and that is part of thinking. So I don't know if that provides more optimism, but it's certainly where we're at.
Okay, we'll get the name.
Thanks, Francis.
As far as the leadership board goes, I don't sit on it, but I was led to believe that everybody was broadly in agreement, and that there was agreement to charging both bikes. No, actually, you're absolutely right, Councillor Adam. There was no disagreement about the charging policy per se. The discussion was about how often the policy was reviewed, because the paper asked for it to be every 3 years. I think Councillor McMillan's point was he felt it should be reviewed yearly, but the discussion came to the conclusion that the IGB could ask for that because we're an outside board. I don't recall a vote, I'd have to go back and see, I thought your amendment was withdrawn, but absolutely the general consensus across the board was to accept the charging policy.
So we've got a few hands up, we've got a few online, so I don't think I'm ignoring you, Mark, I'll bring you in next, so I'm going to bring in Kat.
Thanks, Chair. Francis, you highlight most of the risks, issues around the complexity, the capacity, etc., and vacancies. And I noticed in the finance paper there's an underspend for this year for health improvement and health inequalities around staff. Is this a national picture or is this particular to Renfrewshire, the high number of vacancies within this part of your part of the system?
Not we don't actually have vacancies in the health and improvement team at the moment, so I'm not aware of that. Sarah, I'm not sure that would factually to. Apologies for me as well, but we do have at the moment a full complement staff.
It may be a lack of understanding on my part in terms of your team, Francis, that I'm conflating those two issues. So my question then would be relating to the risk itself. Is that a national picture in terms of ability to improve the absence level and sickness level, or is it particular to Renfrewshire?
That relates to vacancies throughout the year, so Francis doesn't have vacancies at present because they've been filled, so that underspend is as the result of vacancies that have been throughout the year.
I'll bring Mark next time, then I'll bring yourself in. Mark.
Thank you for the report and the staff's efforts and involving me on it.
No, there you go, Mark. I'll bring in Mark first.
I didn't realise it was one, sorry. And involving me on it, I very much appreciate that. One issue that's coming out from the carers is this very little detail in how this is going to look. When we're doing the focus groups, can we look at, say, I don't know, particularly goes to the daycare for 5 hours. We know how he's going to get there, what he's going to do, and how he's going to get back, and his needs. That also gives the carer those 5 hours to go out and do appointments and do the shopping. If we're going down the route of community hubs, but he's only going to be going there for like 1 hour, how's it going to look? How's he going to get there? What's he going to be doing when he's there? And how's he going to get back? There's very little detail coming out that tells the carers how this is going to look. And then my other point would be to the IJB is when you're voting on it, are you 100% sure and do you fully understand how it's going to look going forward? So once this has been implemented, how is it going to look for the carers going forward? That would be my next concern. Thank you.
Thanks, Mark. Yeah, absolutely. We can help try and build what a day in the life would be. I think I would just add a bit of caution that there's a slight balance in that, because the focus groups, and this is why we're having focus groups around day services, is that we can give broad principles around what we're looking to achieve. But I think some of the detail that we hope there is actually scope for stakeholders and carers to influence some of that. So it might not be as specific as some of the details you're setting out, but I think we could paint a better picture for you of what community and hub models look like and examples from elsewhere. So we'll take that on board. I know we've talked about it and you've said that that would be important as part of the focus groups. And I suppose just picking up on your second point in terms of the IGB members and voting members from the vote list, and I'll pick up on Councillor McMillan's point, and we will ensure that invites are sent out both for the focus groups and of course the public engagement for IGB members to attend to hear this, but we will obviously have right up to these sessions too, but if members want to attend and listen to them and join in, they're more than welcome. So yeah, we'll take that on board, but there will be a balance, because if we had decided everything it would be pretty disingenuous to hold focus groups and ask for your views. So there are parts of these services where we don't everything nailed down, but there are, I suppose, we've got to say them, they're fundamental things that we know about the model that we can share. So we should have it.
Mark first.
Thank you very much, Mark Ferguson from Unison. I just wanted to raise, in terms of 6.2 bullet point 3, I think that paragraph could be expanded significantly around staffing and the transition through this programme. It refers to sickness, obviously, and it refers to recruiting and significant levels of demand. But what we've got to realise is the staff have to be taken along this journey, proper communication, so they fully understand and appreciate what's happening, because they're the front line, and any kind of backlash or any adverse impact they're going to face it first in the front line. They have to be equipped with information that they need, but also I think significant work has to be taken to manage that process with staff carefully, looking at updating, risk assessments, updating the stress risk assessments, making sure that the staff are supported, because I think that paragraph is one of the biggest risk factors in the whole thing, and it has to be done very carefully. And I just want to say, in terms of, and we have real concerns that, like Councillor Lisa Marie Hughes, have been inundated because people thought the IGB were taking decisions today around the future of this programme. But I want to say that I think that I can't underestimate the work that's needed. It goes beyond just, my representation here and the wider engagement with trade unions and staff side. I think that there's an onus on the employer to make sure that their staff are fully equipped and supported, because I don't think it'll just be sickness and recruitment will be the issue. I think it'll be operationally day to day that it could become really problematic in the staff being able to undertake their duties.
Thank you for that, Mark. I know it's something that only you find out yourself, Mark, when it comes to that. So I appreciate the Mark. Thanks. Right, let's see. Paul.
Thanks for your report. There's clearly a lot of work being put into it there. Can I ask some questions about the timing? We discussed earlier the reserves policy, and your subsequent paper shows you there's possibly no reserve at the end of 2026, 2026 or 25, 26. So clearly that's not a sustainable position. You're going to have to make statements at some point. You either do it on a planned basis or you do it on an unplanned basis when the money's run out. So in this respect, some of the proposals are a long time developing. I realise we've got to a lot of discussion and so on, and engagement and so on here. But the fact that a lot of these are coming back in September means only a 6 month of financial year to take things forward. Is there any way you can expedite these? And in this regard, also, I think the proposal in section 5 for what can be managed in-house rather than full public engagement is a potential way forward. But I'm just saying you're not giving yourself a lot of time to make budget savings, which are going to be inevitable coming down the line.
Yeah. Should we see that?
Well, I can pick up initially, Sarah may want to pick up on the part savings, but in terms of the timelines, I think the update I've given today and the questions that have followed have really highlighted the need to make sure that we get this process right, aligned with planning with people in terms of engagement. And as Mark highlighted, in terms of workforce engagement, we've been doing focus groups and sessions with staff. There was a management session that took place with all the day services staff yesterday. So alongside the engagement we've set out for public and service users and carers, in parallel with that, we've also got a whole range of engagement activities planned with our staff, and staff form also part of the design authority that we mentioned, and that is where we've strengthened that governance to include things like health and safety and some of the aspects that you mentioned that staff will be concerned about. But given all the factors that we have discussed today, there is no way that we could expedite these proposals any quicker. I don't think we would do justice to the proposals, the people that they impact, and also to be able to provide the detail to allow the IJB to make informed decisions. However, and Sarah probably pick up on this, but in parallel with this, we've been doing a lot of management efficiencies and work. So, Sarah will often talk about things where it's a good position, but not a long-term good position about work that we are doing. And that is to allow us to get more recurring savings that can offset until we can deliver some of these more sustained savings. So I'll pass to Sarah if she wants to add on that. That makes sense. Thanks.
Yes, just to add to that, that we haven't built these savings that are coming in September into 25-26. They're part of the 26-27 budget that will come in April next, well, March next year. So this year we are relying on reserves, as you have highlighted, to deliver a break-even budget. But those savings that we're talking about, phase 3 savings, are related to 26-27.
Just to clarify the earlier conversation, there was actually a vote taken at that particular board. Sometimes the minute doesn't reflect actual what the conversation was all about. And that's fair enough, that's just the way it works. But there was an amendment put up to just review it annually. And the reason for that is because there were certain people in the room were concerned that the tiering was going up too fast. And that's why it was put in just for a year, so we can look at it again next year. Unfortunately, that vote was lost, and that's what's reflected in this minute. So hopefully that clarifies things.
You know that normally quite really well, but I've looked at the minutes myself, and you're absolutely right. There was a vote, but the amendment was purely about the reviewing, and I believe your exact words were, I'm not arguing with policy per se, it's just the reviewing. So it's unlikely people have a look at it and they can make up their own mind, but I have to disagree. I know normally we don't, so it's not a comfortable place for me, but I have to be clear.
Okay, thanks, Mark. Thanks, Jennifer. I held off my question on this paper to the end because actually the issue I want to raise before I put this on. Thank you, Chair. The reason I held off to the end to hear the discussions around this is really helpful. But my concern and my issue straddles this paper and the next paper as we go on to talk about the budget. I don't want to start the conversation about the next paper, but within that we can see, almost overnight we have an additional £1 million pressure over months we've had, and making no comment about the logic of them, but we've had changes in prescribing laws, employers' national insurance, upside around pension. So the finances change overnight for us. And by that, I don't mean small incremental amounts. These are millions of pounds changes that are flowing through at pace. However, our planning for the future around sustainable futures is very long term. And we've heard all the reasons for that, but I think there needs to be a better understanding, a better response to how do we make our organisation more agile to respond to that, because there are factors that influence our budget, even now, in the very short term, that have sweeping implications, but all our planning is much slower, so we have no agility coming through in our planning and sustainable futures compared to the budget. So my comments straddle both the papers because we seem to be working at different paces in the two, and that was a real risk to staff, service users, and as the organisation fulfil its legal obligation, and we then put us into a recovery position. These are real risks that people don't necessarily come out when we look at service change on one paper and then financial plan on another, but actually they are one and the same. So it's really to raise that real concern I have.
The facts might want to come in on this, I think. I totally agree that finances are moving rapidly, and like I say, overnight, it's not helpful to be in that position, and there's very little we can do to influence some of that. But we are very much tied, as Francis has highlighted in her presentation, by the governance of planning to people, etc., and the need to engage. And that does reduce that flexibility somewhat, which is frustrating, but it's actually not something that we can actually forget when we're actually working with the savings options. But I do agree it does make it very difficult for us to be flexible. Francis?
Yeah, I take on board your point, lads. I would just highlight that in Renfrewshire, I think we have been more proactive than a lot of areas in terms of taking our savings in December rather than at the March meeting with the budget, and I hope that, you know, that we can get in a better position around that. So we have been trying to be as proactive as possible, but in terms of agility, to respond to the budget pressures, and Sarah's outlined some of the challenges which are out of their control and some of the expectations around how I suppose the governance and engagement and how we progress these. So yeah, that is a bit of a tension that we continue to work through.
No more questions or comments? No, okay, so we'll read the recommendations in page 16. Page 16. And then we move on to item 8, which is the budget for the there was an update as to the received yesterday, so that we received the updates. Okay.
So apologies for the update that came out yesterday. As Max highlighted, things do move very quickly. When we found out yesterday that our adult social care uplift was going to be substantially different to what the council had originally planned. So whilst the council are absolutely passing through 100% of what they've been allocated, their allocation from the Scottish Government has reduced significantly. I don't intend to go through every page of the paper because it is quite a long paper, but I would like to just highlight a couple of areas just for noting. And the first one is in section 4.6.3, and this has already been highlighted in the Chief Officer's report. I think it's really important to note the information that came out of the Audit Scotland Finance Bulletin, and that talks about the IGBs as a whole across Scotland and the funding gap that is currently significant and growing. And then if I can draw your attention to 4.10.3 and 4.10.4, this is in relation to the change to the employees' national insurance contribution. We don't have absolute confirmation yet of the amounts that we're getting, but we will get 60% of whatever is allocated to the council and to NHS GGP to help towards the funding of the employees' national insurance for our own employees. So that has been built into the budget yet, but the actual amount will be confirmed once they get their allocations. We then draw your attention to section 4.12. Just to highlight that the current, if you like, bonus that we have from the reduction in the superannuation and Strathclyde pension fund percentage that we are paying reduces the current burden in 25-26 on our bottom line, but then that goes back up again in 26-27. So that's about 3.4 million that we won't have going forward. That's been non-recurring monies that we've really benefited from over the past couple of years, and that gets stripped away next year. We then move on to the section 7, which is the delegated adult social care budget. And what the council's proposal is that they will allocate 111,803,000. So that is a reduction from yesterday's figure, unfortunately, and that reflects the change to the real living wage, which was at 5.388 and is now 4.287. And that just reflects the allocation from the Scottish Government, which is based on GAE, and that's the council's allocation. And they are actually proposing to fund 100% of what they receive. We then draw your attention to section 8.5, which is the health allocation for 25-26. What I would say is this does not include additional monies which the board have just said that they will allocate to us on a non-recurring basis, and they are agreeing to pass through 766,000 in 25-26 on a non-recurring basis to help fund prescribing. So that will come to the IGB in June as a request to carry that forward as an earmark reserve purely for prescribing, and that money comes from monies that the Scottish Government are allowing the board to carry forward, and it's to do with slower progress than anticipated for the ARC changes within the board. So we are getting the benefit of that, but it has to be ring-fenced, and the IGB will be asked to carry that forward in June. So I think the final thing I would just say is to draw your attention to the actual overall budget, which is in section 10.1. There is a table that highlights the pressures themselves and how we intend to fund those. So you can see quite clearly that the non-recurring funds are about 9 million that we will draw down to help fund the bottom line in 25-26. So my recommendation is that we agree the budget to deliver services in 25-26. Happy to take any questions.
Thanks, Chair. I just wanted to say I'm disappointed about the reduction in funding that happened so swiftly, and I know how difficult that makes life for you, Sarah, but all of your team to just change everything at the last minute, so that was disappointing. But I just wanted to say, mention about employers' national insurance contributions, social care, so making the correlation in health and social care, and this impact is going to be felt greatly, not just for us as an HSCP or public sector and council, but it's the small care providers, and I'm really, really concerned that it's going to break the system. I mean, we do well with a billing discharge, but if all these little care providers go, then the system is going to be broken, and I think I just hope that there's some solution found for the future, because it's a real concern.
It's a real concern, Jacqueline. Is right. Yeah. Any other questions, comments? I'll just for clarity. Oops. Yeah.
Thanks again. Just looking at the risks again, as I did the previous paper at 11.6, kind of says it all for me. It says that inevitable that future saving proposals will include reductions in care provisions, which may result in, and I'm not going to read that out, I'm sure people have read it, but obviously the changes to service provision will have a devastating effect on many people in our community. I'm certainly not happy with the direction of travel, and I'm not blaming anybody in here because we're forced into this, so I'm not going to fall out with Jacqueline or indeed anybody else, but as I say, it's just unfortunate. A mixture of UK government decisions along with Scottish government decisions that we find ourselves in this. And again, 12.3, if we don't make these savings, which is a possibility, we could enter into financial recovery. And I think that's appropriate itself in the room. And there's one thing I always find kind of refreshing about the IGB is to say the truth. The officers say the truth, because sometimes in council papers these things are kind of hidden away and not spoken about. But that's one thing I find refreshing. It wasn't the case, and we weren't mentioning it at all, but at least I appreciate people's honesty. Thank you.
Just a brief comment about national insurance contributions, and also it's worth noting that independent contractors are also not covered by the mix funding. So general practice, we certainly are awaiting what the impact will be come April, because there may be posts held in small organisations, because similar to care providers, these are not large organisations, and they have lots of people who will be affected by changes in it. So it's just, I guess, a caution around all of our independent contractor services in primary care. So community pharmacy, dental, and optometry, I believe, are also similarly impacted by as care service will be. So we may end up with a strange situation where we have underemployed GPs, for example. I know we've gone from a situation where we've had workforce challenges, but it may be the case that posts that have been held are not fully able to be recruited to just because of the kind of impact of that. So we wait.
Thank you. Thanks for highlighting that. I'm just going to read out the recommendations as clarity. Page 26. It's note that adult social care budget for 25-26, appendix 3. Note the delegated health budget for 25-26, appendix 4, which is subject to any final adjustments and the current budget adjustments We have other funding allocated to the next British Government in respect to the impacts for 25-26 period. We have other funding allocated by the Scottish Government in respect to increase the employer's national insurance contribution, including the fund's sustainability payments. I believe the balance budget outlining S59, including the drawdown of the parish reserve, so we're still very part of budget. Moving on to item 9, which is the medium-term financial plan.
Okay, and yet again, I'm afraid this PMAT is a late assessment because the impact of the change to the living wage in the budget also has affected the medium-term financial plan because it affected all of the carry forwards. So apologies for that. However, the principles do remain the same. And I'm afraid similar to the budget, it doesn't give any good news to members, I'm afraid. So I won't go through the paper and the document itself in too much detail. There are a couple of areas I would like to draw your attention to. And I suppose if you go to page 3 on the actual, I don't have the page in the papers in there because it's been changed because it's a revised paper. So the page 3 of the medium-term financial plan highlights that over the next 3 years, based on the current scenarios, without any reason, the range falls between 31.6 and 47.8 million of a gap, which is significant. Another area I'd also like to draw your attention to is about the fact that if you go to page 25, it sets it out even further, right across the period and up to 10 years, and what that gap could potentially look like. So it's quite sobering information to look at, and I'm really that it's not a good picture and not one that we can influence too greatly other than taking forward a sustainability programme and any forward transformation programmes that we have. In addition, if you look at page 28, it does show the impact and sensitivity analysis of any change of 1%, for example, on the pay award, that's £1 million. On prescribing, that's £500,000. So the impact of any small changes to our budget position are quite significant. So hopefully it does summarise the overall position over the next 10 years. But what I would say is that these projections are based on the current position, and as we know, these change significantly over time, so we can only take so much influence from the current position as we're looking at it today. For example, when we looked at this last year, we didn't have any information on ENEX. That wasn't an issue for us. So today it's just presented to you on the basis of the information that I have at present, and members are asked to note the information within it and approve the medium-term financial plan today. Happy to take any questions. Do you have any questions? Great. So if that's the case, can we do the recommendations on page 101? Let's see, look at assumptions and benefits, the benefit and the information on the weights, and the labels on see uncertainty, the excess relation to the range, these assumptions, and approve that with the medium-term financial plan from the first 20 weeks of the financial plan. This is always at 10, which is your market facilitation plan, that we've told us 100%.
Thanks, Chair. So I'm Thomas Patterson, satisfied the general contracts and commissioner with the HSCP. Members will recall we brought the last market facilitation plan here in June 2023. And then last year in September, I brought an update to that plan, which also covered some of the recent and upcoming procurement activity that the council was taking on behalf of the partnership. So market facilitation plans is a requirement on IJBs to have one. Most recently, the Scottish Government updated their strategic plan and statutory guidance document. They updated that in June last year, and that reaffirmed that IJBs across the country should have a market facilitation plan, which should be prepared to complement our strategic plan. So that's what we've done here. A market facilitation plan would be an enabler of the strategic plan and should be read alongside, importantly for us, given the financial context, read alongside the medium-term financial targets Sarah's just spoken to. Market facilitation being the relationship between market intelligence, market intervention, and market structure. So the plan itself for 25-27, we included again some key demographic information. The whole purpose of our market facilitation plans to help provider organisations, both existing and prospective organisations, make informed decisions about working within Renfrewshire, making sure they understand the needs of the population. I think it's important to say, as we reflect over the last couple of years, that I think the social care market in Renfrewshire has demonstrated itself to be A, very high quality, and B, highly resilient over the last couple of years, and a number of steps that we've taken. We hope to continue that. I mean, we rely greatly on the further independent sector to deliver services for us, and we can absolutely demonstrate that we do that effectively. So we've come up with a vision for the 2-year market facilitation plan, which is that the IGID strives to support the development of a social care market which is sustainable, diverse, and person-centred, and enables individuals to live fulfilling lives with dignity, choice, and control. In order to achieve that, we have 5 objectives, and each of these objectives have a number of actions. So just quickly, for members, the objectives are to ensure a wide range of high quality services are available to meet the changing needs of our population, ensure the services meet the highest quality safeguarding standards, increase choice and control for individuals who use services, foster innovation, technology, care, and lastly, to further develop collaborative commissioning practices. And as I said, we've got a number of items, a number of actions listed within the plan that we can hold ourselves to over the lifetime. We have also reaffirmed our commitment to ethical commissioning principles, and I think we've given a number of examples how the commissioning practice within Renfrewshire aligns to those nationally agreed principles. And lastly, I would just highlight the key market messages that we've drawn out. So firstly, and importantly, is around about sustainable futures. So I guess my message to the market, both existing and prospective provider organisations, that we are in the midst of a sustainable futures programme, and we've got, as we already mentioned today, a number of savings proposals that we'll be working through, and an expectation from us as an IGIB that partners and provider organisations work with us towards these changes. Technology enabled care and support in another key market message. So I guess we're highlighting our digital and telecare working group, which has been established, but really just promoting an open door to particularly national provider organisations who make good use of technology enabled care solutions, and welcoming any ideas about how we could work more effectively with our commission services. Renfrewshire. The third key market message around about delayed discharge. I think it's celebrating the achievements around the delayed discharge, which are achieved in no small part due to effective social care market in terms of care homes, care at home organisations. But really just laying down an expectation that we'll continue to expect support in relation to delayed discharge. We've highlighted resilience in crisis preparedness as a key market message. And that's really about individual organisations' business continuity arrangements, highlighting the risk from severe weather events, power outages and cyber attacks, and ensuring resilience in the marketplace. And lastly, transitions, so recognising the importance of individuals transitioning from children to adult services, and how pivotal that period is in individuals' lives. a message to the market that we expect and require their support over that crucial period, and working with them through that. So I guess moving forward, we'll publish this with your agreement. We'll publish this plan on the HSCP website. We'll share it with all existing provider organisations, and we'll share it broadly across national forums, Social Work Scotland and else. We're happy to take any questions.
Thanks, Thomas. Thank you for the work. We put into the report. Any questions or comments? Yes, Jacqueline.
Thanks, Jennifer. Just a comment about transitions. It's good to see that bit in here. Certainly, you know, in my early days as a councillor, I have a lot of inquiries about transitions, and it's something that people are really concerned about. So to have care providers behind us, they will help with that transition. I think obviously we've got children's services separate in the council, and a lot of IGBs have them integrated. But I mean, I quite like the approach that we have, but I think it's really important that we get transitions ready to protect that status that we have, and to get the care providers on board as well. I think, you know, I think we've still got work to do there, because I still sometimes get advice, and the carers will raise it whenever we're at the carer centre. So good to see that.
It's a dry Jacqueline. As an Alex member, when I first got elected, one of the first things that really were flagged out to me, the transitional period now, the 50-year-old, we've dropped off and we're not getting support there. Basically, when you think of children's services to adult services. So no, thank you for that, Thomas. Alan, you get it. Come on in now.
Thanks, Chair. I sort of welcome this report. Obviously, I think it's really well laid out with Thomas, and obviously the mentions of the third sector throughout is useful as well. And I look forward to sort of meeting with Thomas to sort of building that relationship again, going back to that aspect of local operations, being able to deliver services in a way that's much more meaningful, in my opinion, that can actually get to the heart of some of the wellbeing issues that have been exercising us today. So I look forward to having discussions with Thomas going forward. So thanks.
Excellent, Alan. Thank you very much. Okay, so seeing no more questions and comments, so we agree to know the report. Page 107. So it takes us on to item 11, posted services, performance, and 2025, which is 199 to 204.
Yeah, I'll pick this paper up. Okay, so this paper provides a performance update on the services, both podiatry services and primary care support services. It also gives an update on GP out of hours, which are not formally posted, but that our chief officer has interim management responsibilities for across GG and C that Glasgow implies. So I don't plan to go into great detail, just highlight a few points for each of the areas. But we do have officers from the respective areas on line that will be able to answer any questions or expand on any of the points that members may wish. So section 4 provides an overview of our podiatry service, noting that in spite of unprecedented increases in referrals, the service continues to meet or exceed performance targets. And I think I would particularly draw your attention to the marked improvement around the most vulnerable patients with foot ulcers, where we've had a real marked improvement since 2022-23, and that's whilst facing much greater demand for that service. So a really good news story. In section 4.7, we highlight how this strong performance is being achieved, and I think it's testament to service, the sort of innovative and agile approaches that they take to things like workforce planning. They've got the Prepare project, which is looking at attracting more students, and that's recognising the very small numbers that graduate in this area each year. And four other health boards are taking Greater Glasgow and Clyde's lead around this, also adopting it on the back of the success that we've had with that. Section 5 of the report updates on primary care support. I'll just pull out sort of two key areas in this. Firstly, the work to support the 6 HSCPs around future planning and the primary care improvement plans. So primary care improvement plans are the delivery framework to implement the general medical services contract, the GP contract. And this includes areas such as transferring community treatment and care, which is often referred to as CTAC, from GP practices to HSCPs. So the report recognises the progress in this area, but also highlights that funding and accommodation challenges mean it's not being fully delivered. I'd also just highlight the work to establish the support and oversight arrangements for the delivery of the board's first primary care strategy, which was approved in April last year. And 5.8 highlights the areas of performance from the first 6 months of the strategy. So I think overall it's reasonable progress, but that's taken account of capacity constraints and a number of national external factors. And then finally, section 6 updates on GP out of hours. It notes the move from a business continuity model to a permanent model based on telephone first, which was also approved by the Health Board in April last year. Given the significance of the changes involved in this transition, the implementation of this model has been subject to organisational change, and the hope is that this will conclude this year. But to date, this has resulted in fewer unplanned closures in sites, and performance exceeds the target position of 90% sites open. Section 6.6 also highlights some of the service developments being progressed, including trainee advanced nurse practitioner programme and the expansion of professional to professional telephone approach. So it's just giving a sort of flavour of the progress, but as I said, we can take any questions with colleagues online.
Sorry, I'm very early this morning. I hope that's all right. No, I just want to say my NHS colleagues will remember the stushy about our service. So I was pleased to see that it's working out well, and hopefully it will continue because it just proves that it was the right thing to do.
Same with podiatry as well. The field was there with podiatry, but remember, it's good to see, and that's how we're performing. It's important to get to see the full officers on a quick basis, so that's really good to see. Do we have questions or comments of mine? If you need to know the recommendation, please repeat it to me. And before we go on to the next day, I'd like to bring in Max, if that's okay, just for me update the IGB on this.
Yeah, so the IGB's model resolution committee met on Friday last week. Quite a full agenda. So just to give there are no matters that I'm raising to escalate to the IGB as a whole, but just to give an update, we went through all of the internal audit activity and planning for the next year. We got signed the external audit plan, which relates to financial statements. We spent a fair bit of time going through the IGB's risks and actions around them. There are a number of high risks, but each of them have detailed action plans around those, and picking up on the business continuity planning piece that is in Karen's toolbox report. We also have reports on health and safety and public actions. Two of the reports were most we probably spent most time on was around mental commission reports on our services, which will look at the recommendations, and it's just to give board assurance that each of the actions that comes out of that do get followed up and to make sure that any actions are either remedied if needed or further work undertaken. Then we also made sure that we tabled all of the Audit Scotland reports, because there have been a number that are relevant to IGB work, either to the council side or to make IGB finances across Scotland. And we also picked up on some fraud training. So that's a quick question.
Okay. I appreciate it. Any questions or comments? Okay, that's great, Barry. Thank you very much. So the next item is the proposed dates for the next meeting.
Just a couple of things. I think it was mentioned at the last meeting, I don't know if it was the development meeting or not, but possibility of going up to the West Coast of Scotland, it doesn't seem to be happening. I'm not like all one way or the other, but I just wondered what happened with that. And also at the last, I'm sorry for not raising this, I wasn't very sure where I could raise this, but at the last development day, we had quite a long discussion about the food train. I was expecting that to come back here for some kind of ratification at this particular meeting. Maybe I was just confused because there was a lot flying across the table that particular day, so he was just looking for clarification on how that situation is.
Operational decision, wasn't it? So that's why we don't see.
Yeah. We will. I can speak offline to someone and get an update on that then. Thanks.
Thanks, Chair. With regards to locations for the meeting, the challenge that we've faced is identifying anywhere that gives us the hybrid facilities that we've got within the council chamber. If we are able to locate another venue that gives us a sufficient size to accommodate the wish to be present in the room, as well as giving us that hybrid facility, we'd be happy to move and happy to look at anywhere else. But at the moment, we've not been able to identify anywhere that would work for us so far.
Good.
Questions or comments? So we can be the recommendations with dates, preferred dates, and I can do that. So the next meeting is 27th of June. Yeah, well. Okay, so just leaves me to thank all of your presence in the company yesterday and your contributions. Thank you very much.
Thanks,
Thanks,
Chair.
Chair. Thanks, Chair.
Thanks all.